thanks so much for being on the show today, Dr. Brown.
Bryan, thank you so much for having me on the Healthy Approach podcast.
Well, I was honored to be on your show a few months ago, the Gut Chat Project, and so I wanted you to be back on my show so we can talk about gut health.
Absolutely, and I like this room. Last time I was here, I was giving a lecture. We had kind of a packed house, so
you sure
I think all this cool stuff that you guys are doing at the Sunflower Shop, and you got your 50th anniversary coming up?
We do next year. 50 years. It's crazy how fast time's gone. But
well, it's crazy because I'm looking at that established 1970, and I'm like, yeah, that's when I was born. Oh, no.
I was born the same year, exactly. Well, I wanted to talk about, you're a gastroenterologist, a medical doctor practicing in Plano, right?
Correct.
And so I wanted to bring you in and talk about all the GI problems that are out there. We're seeing so many people on PPIs and really don't know where to start on how to either get off them or get their gut back to where it needs to be. So let's start. What are the most common things you see in your practice right now as far as complaints?
Wow. So as a gastroenterologist, I was walking around your store, and I just realized how many things are for gut health and related to gut health.
That's right.
Or at least people are trying to get into that space. We clearly are becoming sicker as a population, and you are in the business of keeping people healthy through nutrition and supplements, and by the time they come to see me, they've kind of exhausted that already.
That's right.
And they've already even seen their regular doctor. So as a gastroenterologist, I'm a specialist in digestive health, including liver, pancreas. I prefer the hollow organs. I like to play video games in people's colons where I can remove polyps and things like that.
That's right.
But as a gastroenterologist, the most common complaints I see are people that have significant stomach pain. They'll have I have stomach pain, and then we need to get into and dial it down. What is that? Mm-hmm. Is that heartburn? Is that bloating? Is that a deep ache? Is that associated with problems when you eat, when you don't eat? Mm-hmm. And then people will talk about bloating, and that's a really big common thing. And
huge.
And most of the time, by the time they come see me, somebody has already seen them and said, oh, well, you just must have irritable bowel syndrome. Mm-hmm. And they eventually come see a gastroenterologist, and I don't believe in that term. That's kind of a trash can term.
Yeah.
And that usually just means that somebody has done some tests and they're normal, and they go, oh, Bryan, you're fine. Good news, you just have irritable bowel syndrome. And you leave the office and you're like, well, I still feel bad. Great, now I have a label, but I still feel bad.
That's
so,
right.
I see tons of that. And then the other thing that people do complain about, all associated. I believe all health begins and ends in the gut.
I agree with that too.
And so I get the people that have brain fog, or they'll have fatigue, or they'll come in and they'll say, ever since I really started having digestive issues, and then since then I've developed Hashimoto's thyroiditis. I've developed XYZ autoimmune issue. So we know that it's all tied together.
It sure is, especially with all the research coming out on the gut-brain connection.
Oh, yeah.
I mean, we are understanding more and more about how important that when we're inflamed in the gut, we're inflamed in the brain. That's
one of the things that I talked about when I came here and gave a lecture that I've expanded a little bit is a recent research came out, and this is really cool, where they took human intestinal tissue and they soaked it in inflammatory cytokines, basically things that when we get all revved up, our body releases these different inflammatory, they call them cytokines, but it's the thing that makes you inflamed.
That's right.
And they showed that the intestinal tissue actually became porous, so it became leaky.
Wow.
And then what they were able to do is they were able to show that they could put in different size molecules that before they put that in there, they didn't go through. Then, when they put the inflammatory cytokines in there, including something called zonulin, which is what you develop when you eat gluten. So that's one of the reasons why I think we have inflammatory foods also. It actually created a leaky gut. Same scientists then took the blood-brain barrier from a human, which is the barrier between your brain and the rest of your body.
That protects you.
That protects you, because you just don't want everything running up into your brain and bouncing around.
That's right.
So the body tries to be very selective about what makes it into the brain. They put the same inflammatory cytokines, same exact thing. You developed leaky brain.
Wow.
So when you talk about the brain-gut connection, it is truly there. And now we have these models where we can show that when you have an unhealthy gut, chances are you're going to have an unhealthy brain.
So what I hear you saying is that if there truly is a leaky gut going on, that means your blood-brain barrier can also be leaky at the same time.
Leaky brain.
That's crazy.
So in this lecture, when I actually talk about these, I've got a picture of a leaky brain where it's just, the brain is like water, and it makes people go, oh, now it starts making sense why. Well, when I started having irritable bowel, I became very anxious. I started having panic attacks. That's when I have different problems sleeping. My depression got worse. And when I tell them, oh, we're going to fix your gut, you're going to feel better. Mm-hmm. I've actually had, my big aha moment was when I had a patient, a mother brought a patient that had very severe autism. And she noted that he was becoming out of control. He was now seeing an adult doctor, and so he was bigger, and it was very difficult to control him. What she did notice is that every time she fed him certain foods, he would act out more, and he was very hard to control. Mm-hmm. And then because you can't just say, do you have bloating, do you have this? But we now know that in certain disease spectrums, an autism spectrum disorder, you can have some intestinal dysmotility, meaning your intestines may not function that great all the time. So you're at risk for certain things like bacterial overgrowth, meaning bacteria is growing where it shouldn't be. Mm-hmm. And so we treated his gut with my product Ultron for that. And we also added some CBD oil, and she brought him back in, and it was the best he's been in 10 years.
Wow.
So we know that there's a connection even in disease states. Some people are going so far as to say that dementia and Parkinson's are related to the microbiome.
Mm-hmm. And that's what I love about you, Dr. Brown. You're educating people about how to take care of the gut, outside of conventional, but research-based. And that's what I love about what you're doing, because I don't find many gastroenterologists who are doing what you're doing.
And unfortunately, we've already said the term leaky gut several times.
That's right.
And I know that you've had some other guests on, like Josh Axe,
yes,
who is a big believer in leaky gut as well.
That's right.
But if you go to a lot of traditional medical doctors, traditional gastroenterologists, it's like their head's in the sand.
Mm-hmm. Exactly. It's like there's only one way, that inside the box type thinking, and you are outside of it. And that's what I love about what you're doing.
And what's fascinating is if you get on the internet, then what you're hearing is maybe just a little extreme, which is big giant holes. But then when you look at the research that's going on with PhDs and bench researchers, the science is so complicated and so exquisite. So when I hear my colleagues say, oh, there's nothing to that, I'm like, you have not taken the time to get on PubMed and search certain things and download these articles, because there's a lot of information out there.
There is, and that's why I'm glad doctors like yourself is out there researching that and thinking outside that box. So what are you doing for that person that's coming in that's complaining of the common issues, the bloating, the constipation, the gas, heartburn even? Where do you start with someone like that?
So we'll start with the most common patient I see. Because of my clinical practice, it's really kind of come down to a second opinion type practice. So if you came in and you said, I've got brain fog, I've got these different things, and my first question to you is, Bryan, were you always like this? Were you born like this? And when somebody says, no, I actually, I had a dental abscess, and they put me on, or sinusitis, and I had to take antibiotics for a long period of time. Ever since then, I've not been right. Or, no, I actually went to Mexico, and I got really sick, and ever since then, I haven't been right. That is the type of person that I think we can really help, because that usually means that you have bacteria growing where it shouldn't be, or bacterial overgrowth. The acronym is SIBO, S-I-B-O.
That's right.
And so that is the type of person that I can go, okay, look, you were fine, something happened, and now you're not fine. It's not in your head. Yeah. You don't just have irritable bowel.
That's right.
And that's always something that I struggled with, where you could, people get labeled as having IBS, but you were normal for most of your life. And so that person, we look at, there's a few tests that we can do to see if you can do a breath test.
That's right.
But most of the time, they've already spent quite a bit of money, and I'm going to say, okay, look, you walk like a duck and quack like a duck. Because I'm in private practice, I don't want to waste any more of your time or money. Let's treat you and see what happens. And then depending on the symptoms and what we can do, there's various treatments, and that's what our research was with Ultron.
That's right.
How we ended up developing that.
which is helping a lot of people with their bloating and gas issues. So let's talk about Ultron,
Yeah.
the word I can never pronounce correctly. So it's
You and
Ultron.
everybody else, trust me, it's not your fault.
It's definitely a unique name. But
Yeah, we actually have the phonetic spelling there, the Trontil. My belly is better.
there you go. I like that. That's a good way to remember it.
Yeah. And when you, when you end up developing your own product and you want to try and name it, call me in and I'll tell you what not to do, because it's really hard to make up a name.
It is. It's so true.
We ended up, when we were doing this, we knew that we were onto something really unique, because it was a very novel idea about using different polyphenols, a combination of 3 polyphenols, to work specifically to get that bacteria to go back to where it should be.
Which is some of the main active ingredient in the herbs that you're using.
Correct. We
Yes.
use quebracho, conker tree, and a little bit of peppermint.
Okay.
Those are 3 polyphenols. Those are the colorful molecules that you'll find on vegetables, which is actually what makes the Mediterranean diet so healthy for you.
That's right.
And so your body takes these in, and then it actually breaks them down in your colon, your microbiome. It always comes back to the microbiome and digestion, breaks it down to beneficial molecules that reduce inflammation. And that's how come when we can get rid of this inflammatory process in the gut, then you start healing in other places.
That's right.
And so we knew that we were onto something. And I'm like, what if this could be as big as I think it can be, then we're going to be Kleenex or Xerox or Nike. And you say these names and it's fine. But when you're not that big yet,
when you're just starting
when
out
you're
there.
just starting out. So we were going to use the word Trontil, thinking that it's like tranquil. And then you find out that these pharma companies have trademarked everything.
Everything.
So then you just have to really make up a name, which is why all these new drugs are these weird consonants. It's like Xeljanz, or they use X's and Z's and everything. So
That's right. Just to be unique in that way. So it's been an awesome product to really help a lot of people with that bloating and gas, which that's sort of what it's designed to do, right? So what are you saying to people who's on all the PPIs, the Nexium, the omeprazole, Prilosec? They're on the antacids and they've been on it for years. And I always point out on the back of the box, hey, it says don't take longer than a few weeks here. Then you need to get off of it. But I know a lot of doctors don't have time to educate people on how to get off that. So what are you doing for people with that?
It's really difficult.
It is.
And first of all, it is the most prescribed class of drugs in the world.
I say it all the time.
And when they went over the counter, so here you have a class of drugs they're tremendously effective at taking away symptoms.
They work.
They work.
That's right.
The problem is, and what people don't realize is, the greatest trick that got pulled was that they went OTC, over the counter. Because when you start on these medications, we'll just use omeprazole, the generic one.
Okay.
When you start on this, what it does is it shuts down your acid production.
Hydrochloric acid.
Hydrochloric acid in something called the parietal cell. Now, the parietal cell is stimulated to make acid by histamine and gastrin and acetylcholine, but gastrin's the main one, the histamine and the gastrin. And so when you shut down the cell's ability, the body knows this and goes, we don't have enough acid. So it produces a bunch more gastrin and histamine. And so you're all revved up. Then when you open the floodgates and you quit taking the medicine, all this gastrin's like, oh, acid, yes. And so people just like 2 days after taking it are miserable. They were more miserable than when they started.
That's right.
So it's this, it's a pretty nice little
cycle.
trick. It's a vicious cycle. So when you try and get off these medications, you really have to wean, or you really have to supplement with something else.
That's right.
And so I remember when I was here last time, we talked a little bit about that. I'm like, what are your tricks? Because I'm trying to get people off of this.
Yeah.
I've tried a lot of different DGL,
Exactly. Glutamines.
Yeah.
Enzymes. I mean, that's sort of what we look at, is trying to give them a little bit of HCl in their stomach by any means, or at least things that stimulate it, because we understand that acid's important for a lot of reasons. I mean, gosh, H. pylori is growing like crazy out there. We've seen a lot more cases coming in going, I've just been diagnosed with H. pylori and so forth.
Man, that's a whole separate podcast.
It is.
As a gastroenterologist, I have a totally different view on this.
How do you view that?
Well, we thought that we discovered H. pylori, whatever it was, 30 years ago or 35 years ago or something. I don't know. My timing is off now. But a Australian gastroenterologist had a theory that bacteria was causing ulcers. And nobody believed him, but he ended up taking a spoonful of H. pylori, Helicobacter pylori, and he almost died of an ulcer. Laying in a hospital bed going, I knew it!
Exactly.
I told you guys.
You so.
He ended up winning the Nobel Prize for that. So it was like, oh, this is amazing. He figured out this organism. And since then, we've realized, oh my gosh, it's probably been a commensal organism all along. They've looked at DNA analysis on exhumed bodies, and it's been there.
That's right.
Then you start looking for it, and you realize that in certain parts of the country or in the world, the majority of the population actually has this.
Yeah, that's what I've heard.
And so then you start wondering, well, wait a minute, could it have a positive role? And in Western medicine, we look at it and we say, oh, we found it, we have to get rid of it because it can cause cancer, it can do whatever.
That's right.
Maybe too much of it causes all these issues, but maybe a little bit of it, like the body knows, could actually control some of this acid that's going on.
That's right.
So this kind of loops back to the question, let's talk about acid reflux, the most common complaint. Why do we see so much of it now?
Exactly. Why is that the case?
Yeah, so some theories are that when we give antibiotics and we get rid of this H. pylori and just completely wipe it out, number one, we're screwing up our microbiome every time we do it.
Exactly.
But then number two, maybe it was doing something. Maybe it was doing something with the lower esophageal sphincter. Maybe it controls the amount of acid that was going on. So H. pylori, people, they go to their family practice doctor and they check stool. They go, oh, you have H. pylori.
That's right.
Here, take these 4 antibiotics for 2 weeks.
Exactly.
And I don't know if that's really the right thing to be doing. And
well, I agree with you. I guess the real question I've always wondered is why do we get too much of the H. pylori? I think a little bit like you're saying is healthy in some way. We may not know why yet, but some of it, the amount is, we all have it to some degree. It's just when it gets out of balance, it seems to start causing some problems. And you're right, the conventional method is just throw a bunch of antibiotics and PPIs at it and hopefully we get better. But my theory, it's just that low acid production in the beginning that doesn't keep it balanced. Because we know microbiome's all about that balance, right, of bacteria.
Yeah.
And when it gets out of balance, that's when some bad things can start to happen.
And that's a really interesting thing because the thing that makes the H. pylori unique is that the way it does this is right underneath the mucosal area. It releases urease enzyme, which creates a little area of a high pH that allows it to live.
Wow.
So your theory of if we don't have enough acid,
that's right.
then they're throwing a little party. They don't need to make their own little environment. They're like, oh, this is like, it's like they go down to the beach and they're like, this is perfect. I need it, I like this environment.
Exactly.
And then then it's too much. And then that does lead to stomach cancer and that does
bad
lead
things
to
happen.
Ulcers.
I mean, they still believe it causes ulcers too because it burrows into what, the parietal cells? Is that what it
Yeah,
burrows
it does. I mean,
into?
we definitely know that it causes ulcers and we definitely know that it's a carcinogen.
Yes.
And so that's what started 30 years ago. We went, get rid of it. Get rid
Yes.
of all of it because it kills people.
But the thinking is that's in high amounts now, right? I mean, a little bit's probably okay to some degree. It's just when it gets out of control, it causes those type of problems.
Yeah, exactly. I was just listening to a Rhonda Patrick podcast,
Okay.
and they were talking about sulforaphane, which
Okay.
is broccoli sprouts. And there was a study that came out of Japan, I think, where it actually showed that the sulforaphane decreased H. pylori amounts in the stomach. So the body has different tricks. There's natural and nature's way of controlling the amount as well.
Totally agree.
Maybe we're seeing so many of these digestive issues here in the Western world because of refined foods, because we're not getting enough of these natural foods, organic fruits and
Fibers,
vegetables,
even
fibers.
fiber. Gosh, I mean, what's the RDA for fiber right now? Around 25 grams, and most of the clients I see, we're lucky to get fiber 7 grams a day. It's crazy.
Yeah, and if your whole, it's fascinating where I'll be driving to work and there'll be a line coming out of Chick-fil-A or something, and I'm like,
Or Starbucks, yes.
there's something's going on there where this is normal for most people.
That's right.
On their way to work to stop by a McDonald's or Chick-fil-A
It's the
or
new
something
normal
like that.
for Americans. It's so true.
And you look at that, and no matter what it is, oh, that's a Egg McMuffin. It's it's the
gluten, the
refined
wheat,
sugar. It's refined
yes.
gluten. It's going to be the flour with some sort of processed meat.
That's right.
And it's
GMOs.
Look at that. Yeah, the GMOs, and people eat it, and you're like, wow, there is nothing that your body really wants in there.
Exactly.
Yes, you're going to get some proteins. Yes, you're going to get some calories.
The macros, yeah. That's about it.
Yeah, that's it. You get zero fiber or very little fiber in the muffin and so on. But yeah, so once again, all health begins and ends in the gut. And I think
Sure
that
does.
everything that you bring up like this, it eventually starts coming back to why. That's the question. Why? Why is it going on?
Exactly. Well, hey, since I got a medical doctor sitting in front of
Yeah.
me, I got to ask the question. Colonoscopy. What's your views on it for majority of America out there? I know what the medical standards are, and I understand that. Do you think there's any risk or problems with them?
So obviously, I'm very biased.
Sure.
I love doing colonoscopies. In fact, that's why I'm a gastroenterologist, is because it's one of the few fields that's very intellectual.
That's right.
Because you have to play detective and you have to know a lot. The gut is involved with so many things. But it's also a procedure-oriented specialty.
That's right.
Most of the time, you're either a surgeon or you're a medical doctor. So that being said, that off the table, that I love doing them and I make a living doing it.
Sure.
We do know several things. We know that colon cancer is the second leading cause of cancer death in the U.S. Here's a really scary stat. A study came out last year that showed that millennials have the highest increasing rate of colon cancer.
Really?
Yeah. It's the first generation to have more cancer than their parents.
Very interesting.
Colon cancer, specifically colon.
And are we attributing that to mainly lifestyle and diet?
We think so.
Yeah.
And so it's not uncommon. It would have been unheard of to be scoping a 35-year-old.
Totally agree.
And now I'll scope them and find huge polyps with early cancer in them.
Okay.
So we do know that it's the second leading cause of cancer death. We always talk about the cure to cancer, and we know that almost all these cancers come from colon polyps. So these polyps grow, and then they eventually become cancer. So what I can do from a preventative standpoint is remove the polyps before they become cancer.
That's right.
So what we have seen in the literature is, since we started doing screening colons, the incidence of colon cancer is decreasing for those that get screened.
You're catching that earlier basis.
Yeah, it's remarkably effective.
Okay.
So the American Cancer Society just came out with new recommendations that everyone should start their first colonoscopy at age 45. The American College of Gastroenterology still has the age 50.
Okay.
But if there's a family history of polyps or cancer, you start at age 40 or 10 years before whoever it was that had it. So in other words, if your mom had a colonoscopy at 40, she had a polyp, you start at 30.
That makes sense.
And then it's every 5 years.
That makes sense.
So we do know that the data shows that it does save lives. Anybody that dies from colon cancer after the age of 50 probably could have been prevented.
That's right.
If you look at it, because we can usually remove those polyps.
That's right.
There's some cases of genetic variants where it's unfortunate, but you know it's just going to be a rapid growing thing. So I don't want to make people feel bad if they're. But most of the time, if you can get in there and get screened, and so that being said, then what if you know that colon cancer is totally preventable, then why isn't everybody getting it done? And it's mostly the stigma.
That's right. It's got a bad stigma on it. I got to ask though, what causes the polyps? What do you think the number one reason of polyps are?
All right, so it has to be something epigenetic, meaning you're going to have a genetic predisposition, and then your environment turns on some gene that does it. Because we know that colon cancer is second leading cause of cancer death in the U.S., but you won't find a lot of colon cancer in Japan. You will find a lot of stomach cancer.
Yes.
So they actually screen for stomach cancer like we screen for colon cancer.
Interesting.
Yeah, it's really interesting. And it's probably something in their diet with their genes. Second generation, they can come over and they can start developing the same cancers that we have over here.
Wow.
So we know that if you're genetically predisposed, so if you have a family history and something in our environment, we don't know what it is yet. But we do know, and they've tried to come out with studies, speculate. Oh, is it selenium? Is it a lack of calcium or whatever? But clearly it's something in the diet, and you just said it earlier. Fiber.
Right.
I mean, is it fiber that we're missing? Are we missing these polyphenols? Are we doing these different things? Are we not getting enough of these natural, like broccoli sprouts and things like that, that have natural anti-cancer molecules in them? I don't know, but that's why, since we don't know, everyone should just get checked out.
But you're starting to see polyps at an earlier age, you said, with the millennials now. So you think those standards are going to change pretty soon then, as far as when they should really be screened? I understand what you just said about if parents got it, then you should be screened 10 years. But hey, we're trying to save lives as early as we can, right? It's all about prevention.
It is, and that's why the American College, the American Cancer Society, just this year lowered it from age 50 to age 45.
45.
And
Very
it'll probably continue until we start seeing the trend the other way.
That's right. Makes sense.
And it's, most of the time, somebody will be, I look for a reason to do this. So I'll tell my patients, look, you've got some rectal bleeding. It's bright red. I do a lot of hemorrhoid work. I love treating hemorrhoids also, because hemorrhoids can be a real pain in the you-know-what.
Of course.
And we can actually fix that. And so most of the time, rectal bleeding is going to be something that we can fix. But it's a reason for me to go in and take a look. And a lot of times I'll find polyps. I mean, adenoma detection rate is well over 40-some%.
Wow.
And these are precancerous things that if we left them all in, a lot of those people could end up developing cancer. So when I talk to somebody who's 40 and they're like, I had some rectal bleeding, I'm like, let's just scope you.
Yeah.
And they're like, well, I don't want to. I'm like, okay, why don't you want it? Well, I don't want to hurt. Well, you're going to be asleep. So you're going to have my buddy Eric, who's going to give you propofol, and you're going to be out like a light, and you're going to wake up and actually have the best sleep of your life. No, I don't want to go through the prep. Okay, the prep is not that much fun. I've done it twice myself, and it is part of it. But if you do it every 5 years, it's not that big of a deal. You're just going to clean yourself out. It's like getting a really bad GI bug, but without all the other stuff.
That's right.
And then the other thing is, if a lot of times, and this is more of a sex-based type thing, but a lot of times people will say, well, I don't want you looking at me. And I have an answer for that. And then the final one is, I don't really want to know. And that's the one that's always really scary. Yeah, because a lot of times, and I see this a lot, where people get so anxious about the negative possibilities that they get really worked up. And if you have rectal bleeding, most of the time I can fix it. Don't get worked up. Don't stare at it and ignore it.
That's right.
Just go in and get it fixed. Regarding I'm embarrassed because you're going to be looking at my butt. If you go to my YouTube channel, Kenneth Brown MD, I actually filmed my colonoscopy live.
Oh, wow.
And we just posted it. And this is a couple years ago, a few years ago now. And I actually comment on it. And you could see that everybody's looking this way because we're all looking at the camera.
That's
is
right.
what we're looking. We're looking at the monitor. And so I've had a lot of people from all over the world that have messaged me and said, thanks for doing that, because that was actually the stuff you were talking about, like right here, what we're talking about, I'm doing live while my partner, Dr. Malik, is giving me a colonoscopy, which I do not recommend. That's the other problem. A lot of people are like, well, I want to do it like you did. I'm like, no, you don't.
No, you don't.
It's just like these lights and these cameras, except you really want to pass gas and you got a room full of people.
That's right.
Like, no, trust me, you don't. Just do it. Just do it the way that we do it for everybody else.
So it's really helping change people's minds about the way they view colonoscopies. That's good.
Yeah.
That's good. So what about your answer to the sexist there? What are you telling people?
Well, I usually have women that'll say, I don't want you looking at my butt. And that's when I say, watch this YouTube video. That's not at all what we're looking at.
That's what you're doing, exactly.
We're looking above. And it's just one of those interesting things. I had a plastic surgeon in as a patient, and we got to talking about that. I'm like, it's really kind of a funny thing in my space, where I will see a female patient sometimes. They'll be like, yeah, I'd like a woman doctor to scope me, and I'll come back to you. And I was joking around with the plastic surgeon, because that's not what women do to plastic surgeons. They're just like, okay, I want this fixed. And they don't say, I only want a woman plastic surgeon.
That's right.
I'm like, I don't know how you guys get away with that.
And you can't.
And I can't, yeah.
And I'm sure men are the worst, because we're so stubborn in many ways. We're going to wait till the last minute, or it's too late.
Yeah,
and that's a problem.
And then that's the other thing, is a lot of people, by the time they come in, it's because maybe they lost a family member or they lost a friend, and so they're really anxious.
That's right.
And I just say, just come in and do it, and make sure it's a board-certified gastroenterologist.
Exactly.
We do ours at an ambulatory surgery center, and that's all that we do.
Okay.
And so it is less expensive than the hospital. It's very convenient. People come in, and I've got all my partners that are there are just all board-certified gastroenterologists over at Digestive Health Associates of Texas, and I love it because we're saving lives.
Exactly.
And
that's the whole
And
principle.
to have people wake up and just go, that's it? And I'm like, yes. And we removed 6 polyps. And they're like, oh. And I'm like, but don't worry about it. They're gone.
Yeah, that's awesome.
That's the cure.
That's great. And you take it a step further by educating people about dietary lifestyle changes to really help them prevent from that occurring again.
Exactly.
What kind of diets are your favorite to help people sort of change their nutritional status a little bit? What do you focus on with them?
I don't try to get too pigeonholed in diets.
Yeah.
I say one thing.
Okay.
colorful plate.
Just a colorful plate.
Just make it colorful.
Yeah, that's a good point.
No matter what you're doing. And if you can make it at home, that's better.
There's go to McDonald's 3 times a day, right?
Oh my gosh. There's a Netflix series called Cooked.
Yes.
Have you seen that?
I have seen it, yes. Very good.
I love the author. He's a well-known author and kind of food scientist and stuff. And he said it best. He goes, you can have a whole apple pie as long as you make it from scratch.
Hey, that's
as long as you make it at home, you can eat the whole thing.
That's a great saying.
Yeah.
Exactly.
Because when you do that, you see what goes into it. You're in control of it. You don't have the other
additives, preservatives, colors,
all that other
dyes,
stuff. And
all that junk.
Probably not nearly as bad as,
I totally agree.
I had my daughter, my wife and son were they're I have a big tennis family, and so they were out playing tennis in some city, and so I would normally not do this, but it's this time of year, Halloween kind of thing and whatever, and my daughter, I said, why don't we, since your mom's gone, because she would never allow this, why don't we make some cupcakes? And we didn't do it like the healthy way, like, oh, let's go get almond flour. I was like, just look up some recipe and let's just go
put it together.
Let's just go and put it together. When I saw it, I was like, this is the healthy version.
Exactly.
This is a lot of butter and sugar and flour.
Yes, that is the true healthy version there.
Yeah, and then you start looking, like, well, that's a cupcake. And then you go, okay, well, how is cake made? Butter, flour, sugar. Okay, so how is a biscuit made? Butter, flour, sugar. Then you realize everything's cake. It's kind of like
your whole perspective on things there.
Yeah, Jim Gaffigan does a whole set on going to a Mexican restaurant where he was a waiter. He's like, have you ever been to a Tex-Mex restaurant? He's like, you ever notice everything's the same? He's like, oh, well, tell me about the nachos. Oh, well, it's just a flour or corn tortilla, flattened out, fried, and then we put either chicken or beef on it with cheese and whatever. Oh, that sounds good. Tell me about the tostada. Well, that is a flattened flour or corn tortilla with chicken or beef, and then you realize it's all the same.
All the same.
Everything's cake.
That's right. Well, where can people go to learn more about you, Dr. Brown?
Well, we can go to, there's several places. So number one, we have a podcast also, which you came on, called the Gut Check Project.
Great
Take
podcast.
a look at that. Hit us up. We're on Instagram at kbmdhealth.com. And then that's the same URL if we're going to learn some more. I'm very heavily involved in the science of CBD. So we have our own CBD, KBMD Health CBD. And then, of course, there's always Atrantil. It's atrantil.com. Atrantil. And then more importantly, you can come in and learn about Atrantil at your stores. You were one of our first people to carry us. I want to thank you for supporting small business.
I like products that work, and it's working.
Awesome.
That's what counts. So you're doing a great job out there educating people, coming out with good products that help support more prevention side before they have to go in and see what's going on inside their colon, right?
Yeah.
That's what we're trying to do.
And we can sit there and, one other thing I did want to bring up really quick, because I totally forgot, this gets brought up all the time. A lot of people are seeing advertisements for a at-home colon cancer test called Cologuard.
Okay.
There's a lot of money going into that. There is a place for that, but what people don't realize is that is a DNA test to see if you have colon cancer.
Interesting. So it's just based on DNA.
It's based on DNA. It's a DNA stool test, but it sees if you have cancer. That's the horses out of the barn already. And the problem is that it has a very, there's lots of false positives. So a lot of people come in
scared to
death. And I want to say that I'm going to get the stats wrong, but 60% false positive or something.
Yeah.
So we're going to catch a few people that were not going to get a colonoscopy anyways, that maybe could do this, but this is not, that you do not want to use that as a substitute.
Okay.
So just that being said, because that's the other thing that just brought up with colonoscopy.
Well, then I'd like to also know your view on what are they doing, thermal scan imaging now? Like Bioscan does over in Las Colinas, they actually doing colonoscopies more thermally. And I don't know if that's good or not.
I am unfamiliar with that.
I don't know what the research
it
looks like on that, but I just want you to know. I couldn't imagine you're seeing the same thing. Plus, if they see polyps, you still got to come to someone like you to get removed.
Yeah, so that's the problem. So when virtual colons first came out, they were saying, oh, well, everybody will just get a virtual colon. They didn't realize that you still have to take a bowel prep. You still have to get a tube in your butt, and you still have to insufflate. And then there was just a lot of missed polyps.
Okay.
And so the bottom line is we got really good equipment, and we get in there and take a look, and it all comes down to getting rid of the polyp.
It's still the gold standard.
Yeah. I mean, I think that if we can get more people coming in to places like Sunflower Shop and cleaning up their diet, I'll probably be out of a job. which I'm okay with because I shouldn't be working that long anyway.
Well, that's my goal is to try to keep you out of business. But
if we can get enough people in here, eventually, if I lose my job, you'll give me a job, won't you?
Yeah, I sure will. But hey, also the same note. I'd rather come to someone like you who looks at both sides of the picture. And so you're doing great work out there. Keep it up.
Thank you so much.
And thanks so much for being on the show today.
Absolutely, this is awesome. I love your setup. Congratulations on year 50 coming up, and.
Well, thanks so much, Dr. Brown. We'll definitely get together again and do this again.
Absolutely. Thanks, Bryan.
Well, that's going to do it for this episode of the Healthy Approach Podcast. Please subscribe if you like this podcast and help us spread the word by rating and sharing with your family and friends. If you'd like to learn more about what you can do to improve your digestive tract, you can go to sunflowershop.com. That's shop with 2 P's and an E, or visit us at one of our 3 locations in the DFW area.